Hello, everyone, and thank you for joining us for today's webinar where we'll be discussing best practices for biometric patient identification. I'm Anderson Dos Passos with Imprivata, and I'll be your host for today's session. I'd like to cover a few housekeeping items, and then I'll introduce our main presenter for today. First, I wanted to let our audience know that today's presentation is being recorded, and everyone who registered will receive an email with a link to the recording if you would like to listen again or share the information with your colleagues. I would also like to ask that any questions be submitted using the question panel and not the chat box. We'll do our best to address these during the Q&A portion of today's session, but if we don't have the opportunity to answer your specific question, someone from our team will reach out to you after the webinar with more information. Now to get into the presentation, I'd like to introduce Rebecca Sliz, our Senior Product Marketing Manager for Imprivata Patient Secure.
Hello, everyone, and thank you for joining today's webinar. I'm Rebecca Sliz, and I'm excited to share with you some best practices for biometric patient identification. There we go. Before we really get into the presentation, I wanted you to consider this image, which is meant to help us think not about goldfish, but about change. Why change? What motivates people to change the way we always do things, to try something new or different? We are on a journey of change when it comes to the topic of patient identification in healthcare. Many people know there are problems with the way we identify people in healthcare today, and that the way things are done creates risks for individual patients as well as healthcare organizations. Yet something is holding organizations back from changing their approach. As I go through this presentation, I encourage you to think about why the time for change is now and how you can help lead your organization in choosing a better way to identify patients. So we'll start by grounding ourselves in the problem of patient identification, and then get into some of its impacts on patient safety and revenue flow. Then I'll introduce you to biometric patient identification, and specifically Imprivata Patient Secure. So misidentification really starts at registration. And this is not just me saying it, but according to a survey conducted by the Ponemon Institute, 63% of respondents said that the problem or a problem occurred at registration. Why is this? Well, despite many advances in technology, including the implementation of electronic health records, patient registration is still a manual process, or one that involves at least two human beings, the patient and the registration staff member or patient access rep. Because of the human nature of this interaction, many things can happen that lead to the patient being misidentified. There can be language barriers or hearing issues, the patient may be confused, and staff are definitely under pressure to check patients in quickly. Patient access staff really are the front line of patient identification, and frankly, they don't always have the best tools to do their jobs. Continuing with this person-driven process, if a registrar can't find the patient or has to choose from multiple records, he or she may just start a new record, a duplicate, or start entering information into a record that looks right, but isn't in fact the medical record for the patient standing in front of them, which results in the creation of an overlaid record. Once the patient is checked in and proceeds for care, the clinician has to deal with the potential mismatch between patients and records, which may lead to things like duplicate tests being performed on patients. Post-discharge, we pick up the duplicate record story again when a claim is filed with insurance against the wrong policy. As finance folks know too well, this can result in denied claims, which healthcare organizations then have to choose to appeal or to write off as bad debt. So hopefully those of you who are new to this problem now have a better appreciation for the various steps involved and the points at which things can go wrong. For those who may be familiar already, this visual may help you explain the problem to others in your organization who may not appreciate the challenges you deal with or the reasons why misidentification happens. When talking about this topic, I often use a widely accepted or industry accepted statistic that 7 to 10% of patients are misidentified when they present for care. Then I usually pause. And the effect is better in person than on a webinar. But I want people to fully appreciate that 10% of the time when someone shows up at a healthcare organization expecting care, there's a patient matching error. So statistics like these sometimes get people's attention, but personal stories can too. Here's a quick one from me, and many people have similar stories. My last name is Sliz, not a very common last name. My dad is Ron Sliz. Recently, my dad went to the doctor for an appointment, and a few weeks later got a bill for Richard Sliz. So he noticed the discrepancy, called his doctor's office, and was able to resolve the issue. But it was an example of how somewhere along the care continuum or his care process, a misidentification took place. Some of you may have heard of the Maria Garcia example, which was documented by Harris Health System in Houston. You may or may not know that Harris Health is actually a user of Imprivata Patient Secure. Harris Health has over 3.5 million patients in their database. In their system, there are almost 2,500 patients named Maria Garcia, and of those, 231 have the same date of birth. This situation is not really that uncommon, especially if you think about parts of the country where there may be large populations of people from similar backgrounds. For example, recently I was at a health system in South Florida where the VP of IT was named Oscar Perez, and he kind of made a joke and said, you know, there are a lot of people named Perez in South Florida. So it can be challenging for registrars to pick the right person or pick the right record when they are checking people in for their appointments. So now that we have an appreciation for the problem of patient matching, let's turn briefly to some of the implications of these errors. Generally, we think of two categories of implications, clinical and financial. With respect to clinical consequences, misidentification can result in patient harm. Some evidence of this, the ECRI Institute analyzed over 7,000 misidentification events and found that 9% of those events resulted in some level of harm to patients. In the middle there, many of you may be most interested in or concerned about the potential loss of revenue that can occur as a result of misidentification. And the challenges with the registration process can also impact patient satisfaction in a number of ways. Patients may be annoyed with having to answer the same questions over and over, some of which involve sensitive or personal information, such as birth dates or social security numbers. They may get frustrated if the registrar can't immediately find their record, or if anything happens that means it takes longer for them to see a doctor. This patient frustration can manifest itself in lower scores on surveys like HCAHPS or other survey instruments. While awareness of the extent of the patient identification problem may still be growing, the Joint Commission has recognized the need to improve patient identification as a key part of hospitals' patient safety initiatives. So one of the biggest implications of patient misidentification is really patient safety. This has been a driver for a number of our customers to actually choose Imprivata Patient Secure when looking at where they're going to make investments and what technology they're interested in adopting. There's research on this topic coming out of Johns Hopkins that shows that medical errors are the third leading cause of death in America, behind only heart disease and cancer. Now, there are a lot of contributing factors to near misses, harm, and even death of patients, yet in many cases, misidentification at some point in that care process is implicated as one cause. And again, while statistics and numbers and research can certainly have an impact both on you as a listener and on your colleagues in your organizations, stories of individuals who have been affected by wrong patient error or misidentification sometimes hit home even more. So this is a story from the headlines earlier this year. Picture a busy outpatient registration area. A new registration staff person checks the patient's driver's license and looks for the patient's name on the schedule. She sees what she thinks is the right name and creates a wristband. The patient then goes into the infusion area for chemotherapy treatment. A nurse tries to verify his information and seems to get confirmation that the information is correct. However, an error was made. The patient received the chemotherapy intended for another patient who had the same name but a different birth date. A serious incident involving a patient like this one can raise awareness pretty quickly of the importance of accurate patient identification. So now we've talked a little bit about clinical implications that can harm patients and hospitals' reputations. Now let's talk a little more about some of the financial consequences. Starting on the left with duplicate medical records. So research about 10 years ago showed that institutions may have 8 to 12% duplicate rate in their databases. More recent research shows that rate to have climbed to roughly 18%. There are different reasons for that, including a lot of the mergers and acquisitions that have happened amongst healthcare organizations, especially in recent years. Identity theft on the right is also on the rise. So several years ago, the number of Americans affected by medical identity theft in 1 year was around 2.3 million people. Today, people talk fairly frankly about fraud and identity theft being an issue in their systems, including that VP of IT in the South Florida system that I mentioned earlier. Misidentification also impacts claims. So multiple sources show that about 33% of denied claims can be attributed to misidentification, costing an average hospital a little over $1 million a year and costing our health system in the billions of dollars. So as an organization at Imprivata, we've been talking for some time about these clinical and financial consequences of misidentification. A somewhat newer angle or topic for us, but one that is in the news virtually every day, is patient experience. The advisory board has recently published a few articles, including an infographic that's shown here, showing that the impact on profitability of poor patient experience can be in the millions of dollars for a healthcare organization. Why is this? One example is wait times. So whether it's in the emergency department or in the doctor's office, or for me in the pediatrician's office when I'm there with my 2 kids who really would rather be anywhere else, patients who have to wait may post a negative review. In our social media frenzied world, that review spreads quickly and really costs the patient new patients, the provider new patients. So this concern or focus on patient experience can lead to an assessment of how an organization can improve the patient experience, starting with registration. How can it be smoother and safer and more satisfying for patients? And that is what we will get into next. We've covered a bit of the problem of misidentification and some implications of the way that things are done today. So now let's talk about why some organizations, many organizations in fact, are choosing biometrics and specifically choosing Imprivata Patient Secure. And keep in mind my suggestion at the beginning of the presentation of we're talking about change and why it's important to change the way we routinely identify patients in healthcare. So one way to address the challenge of misidentification is using biometrics. And I recently came across a report on biometrics in healthcare that I felt really summarized why there's such a good fit between biometrics and healthcare. It starts with the need to identify patients with a high degree of certainty. You would want to say even 100% that we know who this patient is in front of us. And that is increasingly challenging for healthcare organizations as they grow bigger, their patient databases grow bigger, et cetera. Identity verification solutions based on biometrics can provide identity assurance and authentication while increasing privacy and security. So that's an important balance to strike between a reliable system to verify identity that also protects privacy and is secure. And last point here, biometric technology can add operational efficiencies to the healthcare system that reduce costs and fraud, as we were just talking about, and increase patient satisfaction by reducing medical errors and doing things potentially like speeding up check-in times, and making patients feel confident that their clinicians are treating them based on their own medical record. So there are some considerations when thinking about biometrics, whether to use biometrics or whether to, and what type of biometrics to use. So some of the considerations or aspects are shown here. Starting from the left, we start with accuracy. So the system, whatever you choose, must be able to accurately match patients with very few to none or to no false positives. Permanency is another important aspect, and that means, is this a physical trait of a person, of a patient, that is stable over time? Will you consistently be able to identify the patient using this trait? Applicability is really about can every patient use the system? And then adoption is really about will patients use it? Are they comfortable using the technology? Is there a stigma attached to it? So those are some things to keep in mind. For Imprivata, palm vein scanning is one biometric option that we offer, and it is a common one in the U.S. Why? Well, starting again from the left, it's highly accurate. So this is one of those 99.99999% accuracy types of examples where palm vein is a highly accurate way to identify a person. It's a unique identifier. Even twins have different vein patterns, which is really what we're looking at, the vein pattern, not like a print, but the pattern underneath the skin. This pattern is developed in the womb and grows as children grow, but the pattern itself is stable over a person's lifetime. Moving to the middle, pretty much everyone is capable of using the technology. There are some situations where someone does not have a right hand, which we typically use. They could use a left hand, but many people, most people are able to use the technology. And we have high patient adoption with palm vein scanning. And this is likely due to the fact, or in part due to the fact, that palm vein does not have any forensic value. It doesn't leave a trace. It's not used by law enforcement or by government. So that has less of a stigma than, let's say, something like fingerprint, which people associate more with law enforcement or government. Oops. So one other benefit of palm vein scanning is, and biometrics, but especially palm vein, is that they can help identify unresponsive patients. So with our system, you can perform something called a trauma search, where even if a patient is unresponsive, as long as there's blood flowing through their palm can be scanned and they can be identified. And we have a customer example here where in their first year, after enrolling over 30,000 patients, authenticating over 60,000 times, they also did 45 trauma searches, and 28 of those people were able to be identified because they had been enrolled in the system. So that's 28 patients that would have been a Jane Doe or a John Doe, where the clinicians would not necessarily have known their medications, their allergies, their chronic conditions, that were able to be treated based on their medical history due to palm vein scanning. Iris scanning is another biometric option for healthcare, and we at Imprivata offer that as well. One of the biggest benefits to iris scanning is that it's a touchless solution. So where there is a particular concern about infection control, or people are just more leaning towards a touchless option, iris scanning can serve that purpose. It's less useful in a way in an emergency department or a trauma situation, because the patient really has to be able to focus on the camera in order to be able to have their iris scanned. So some pros and cons, as with all options, but that is a little bit about iris scanning. I mentioned that that iris can appeal to people who might have concerns about infection control. We have heard this concern from customers, and as a response have introduced some antimicrobial offerings. So within our palm vein scanning offering, the scanner itself, as well as a plate that sits on top of the scanner that helps people place their hand in the correct place, those components are now both antimicrobial. So that gives some peace of mind to infection control or nurses that may be concerned about this. There's also cleaning protocols that we share with folks and encourage people to do things like use hand sanitizer before scanning, those kinds of things that really make the potential risk no greater than touching a doorknob or a remote control or various other things that patients end up touching in a healthcare setting. So now that we've talked a little bit about biometric options, palm vein and iris, let's talk for a minute about why healthcare organizations have chosen to work with Imprivata to implement a biometric patient identification solution. So one reason is that we understand workflows. Those of you who may be familiar with the rest of the Imprivata portfolio know that we have expertise, deep expertise in clinician workflows, and work with organizations to ensure that they are getting the right balance between security and efficiency for their clinicians and improving their operations. We bring that same kind of lens and expertise around patient workflows. And this slide just shows the various steps in the registration process that we have identified and have helped customers with, and that can be streamlined with the use of biometrics. So this is kind of a nice summary of some of the benefits that a biometric patient identification solution can bring to a healthcare organization. So starting on the left, some of those patient safety benefits. So that has to do with even the creation of duplicates and overlays, which means that clinicians may not be treating a patient based on that person's complete medical history. It also helps to identify unconscious or unresponsive patients in an ED setting. We talked a little bit about the potential to reduce identity theft and fraud. it's hard to fake a hand. So people can come in with someone else's insurance card or even someone else's license, but once they put their palm down, we know who they are. So that is really a common reason that people have given for choosing something like Patient Secure. We can help drive revenue cycle efficiency. So there was that stat about claims and denied claims due to misidentification. We can help reduce those as well as the cost for duplicate record cleanup. And finally, enhancing patient satisfaction. Increasingly important these days as health systems want to maintain and grow their patient populations, that we can help with a smoother, safer check-in process. So here are just a couple examples of customers nationwide who have benefited from biometrics and from implementing Imprivata Patient Secure. So Community Hospital Anderson on the left is a community hospital in Anderson, Indiana. There is a case study which describes some of the benefits that they've seen from Patient Secure, as well as a video on our website that shows senior leaders, so the president of CHA, the CFO, these leaders at this level saying that if Patient Secure saves even one life, it will be worth the investment in the system. Just briefly in the middle, Centera's story, also a case study available on our website about how they integrated Patient Secure into an emergency room, emergency department environment, is definitely worth a read, as this is certainly an area where there's a sense of urgency to check patients in, to get them treated, but it's also critical to be identifying patients accurately. I may have mentioned before, but there are a number of people and departments who are affected by patient misidentification in a hospital situation, and these are all people who can potentially be champions for the system and who may need to be brought on board as you seek budget for a solution like Patient Secure. So here are a couple examples here, including clinical leadership, financial leadership, IT, patient access. We've seen that it's often taken a partnership amongst these departments to both purchase and implement Patient Secure, and we are more than happy to work with you to help build the case for your organization to make this kind of investment. Oops. So just an example of how we are seeing momentum in the marketplace around patient identification, recognizing that this is an important issue and should be a top priority for health system leadership. We did a survey earlier this year, and it was via a website called healthsystemcio.com. So the audience was really CIOs and IT folks. And the first question was, is addressing the patient matching problem among the highest priorities of your health system leadership? And 66% of the respondents said, yes, it is, or it should be. So that is significant in our minds, and this survey the results have been picked up by a number of other media outlets which are really showing some interest in the fact that people, including CIOs, are recognizing that this is a problem that they need to address. I mentioned how some ways that we can help. So we can help build the case for Patient Secure. We can also help with achieving staff and patient buy-in once the decision has been made to implement Patient Secure. So some of the ways that we can help are around internal training, external marketing, some patient adoption strategies, and of course the IT aspects of solution implementation. I'll just make one more comment here, which is that the technology, the solution implementation is one part of solving this problem, but it's really about engaging people and changing behavior in terms of using a different way to identify patients, and one that is initially one that they have to learn, but can really help with staff and patient confidence over time. Imprivata Patient Secure has been a market leader in the area of patient identification for healthcare over the last 10 years or so. So working with about 75 health systems, over 500 hospitals, and 2,500 clinics, and collecting a pretty significant body of patient identities. Not that we store them, but these are the number of people that have been identified with Patient Secure, and many authentications happening each day. So this is coming to the close of our presentation. I just wanted to leave this slide up there for you, which is to say that there are a number of additional resources available on our website. So some of the case studies that I mentioned, a couple white papers, and some videos which show some other customers who have gone live and implemented Patient Secure, and they do a great job of sharing why they implemented and the value that they're seeing from having a biometric patient identification system. Thank you for your attention so far, and now I will turn it back over to Anderson to see what kinds of questions have come in.
Thank you, Rebecca. Now we're going to get to the audience questions. If you haven't yet, please enter your questions now into the question panel on the right of your screen, and we'll get to them as much. All right, so first question here we see is, why do patients still need to provide their date of birth?
Yeah, so when patients authenticate, which is when they come back to the hospital and they're checking in, the patient access staff would ask them to place their palm on the scanner and provide their date of birth, and that is really to comply with the Joint Commission's recommendation for 2 factors of authentication for a patient. So it's not necessary, but it is helpful to comply with that recommendation.
All right. Another question here is, how do you see Patient Secure as helping with the patient experience?
Sure. So I think that a couple words that come to mind in terms of how it can help with the patient experience are smoother and safer. So the smoother, it's true, and I'll acknowledge that when the patient first enrolls in the system, it is an extra step. So they need to provide the same information that they would usually provide to register, but then they'll need to place their palm on the scanner, then they'll place it again. There's 2 scans for the enrollment process. So there is an initial extra step, but then the next time they come back and all subsequent visits, all they have to do is place their palm and provide their date of birth. So instead of having to repeat their information, share that sensitive information, even though there are signs in most healthcare offices or situations that say, please step back to respect the patient in front of you, it's still a fairly open environment where sensitive information can be requested or you have to provide it. So it can be smoother and safer in that regard.
Thank you. Another question here is, what has been the tipping point for organizations to invest in Patient Secure?
That's a good question. From having interacted with a number of customers, I would say that the tipping point is really around patient safety. So that's either something that's happened in an organization, and some of those things make the headlines, like the one that I shared in the presentation, and sometimes they don't. But it can be, and occasionally has been, an incident that has driven an organization to do something different. And in some cases, it's more of an insurance policy against a patient safety incident like that. So wanting to be sure that there are no incidents, or that the organization is taking all the precautions it can to protect patient safety, can lead people to look at a system like Patient Secure.
All right. And another question will be, who have you seen being the quote-unquote champion for biometrics in a health system?
So I'll give one of those answers that seems sometimes less satisfying, which is it depends, but it's really true. We've seen a variety of functional leaders or C-suite leaders be the champion for Patient Secure. So in some cases it can be an IT leader who's equally passionate about patient safety and data integrity, because those folks are also making, significant investments in EHR systems, so want to preserve data integrity as well as promote patient safety. It can be all the way up to the CEO. We've had some examples where the CEO was interested in having the best technology and using technology for patient safety or to promote the patient experience. So they've been the drivers for Patient Secure. And sometimes it starts with patient access. As I mentioned also, patient access is really the front lines of patient identification. That's what they do day in, day out, every single day. So they sometimes can appreciate the benefits of Patient Secure and champion it up through their organizations.
And another question too, what is integration like with EMRs?
We are very tightly integrated with a number of major EMRs, including various ADT systems or admissions, discharge, and transfer systems, so tight integrations, as with other products in the Imprivata portfolio.
Okay, thank you. And then we'll get one more question over here before we close. Which hand do you enroll with and why?
So we typically suggest that people use the right hand to enroll and authenticate patients, and that's partly for consistency. It's easier for everyone, both patients and registration staff, to remember right hand for enrollment and authentication. So again, I mentioned if there is an issue, then we can use the left hand as another option, but if it's available, we use the right hand.
All right, I think it's about time to cut it off there, and thanks again to everyone for joining us for today's discussion. We will be following up with any questions left unanswered, and we will be sending out a recording to everyone who registered. Thank you very much for attending.